So we're going to do a mucosal bleeding time. So you'll start with having the animal under anesthesia or sedated, have them in lateral recumbency. You'll put the needle against and at the same time you'll hit start. And then you'll wipe away every 5 seconds until it clots, and then you'll have the timer going. Okay.
She breathing?
Yes. When performing a blood film, you'll want to use blood out of an EDTA tube, which has an anticoagulant in it, and make sure that is inverted about 5 to 10 times. You'll want to use a capillary tube and then twist the blood up into it. And then to create the blood film, you'll use a microscopic slide, do a drop of blood. Do another slide at 45-degree angle, come back to it, have it slide out, and then push forward to make a feathered edge. And after you have the feathered edge on the slide, you'll soak it in the stain 1 for 15 seconds. And then you'll dip it in the stain 2 15 times. And then in the last stain 15 times. And then rinse it off and then heat fix it. So I'm performing a microscopic blood film, and then when you're looking at it under the microscope, you want to count for 100 white blood counts, whether it's neutrophils, lymphocytes, monocytes, basophils, band cells. And then you want to count to see the percentage of how many within that 100 there are and how many platelets you count within the 10 films, and then doing an average of those. Alright, so today we're going to be doing a blood chemistry test, and so I'm going to pull some blood out of this cephalic vein. So, and then we're going to need to pull about 3 mils of blood. And then you want to put it in the EDTA tube first for the anticoagulant. You want to put about half of it in there. And then the other in the green top. So we've been spinning the blood once we pulled it to get the plasma on the top. And then to get the fibrinogen off the top. It's more accurate results. And we put it in here. We've already put the slides for such as the BUN and the glucose and the creatine. We're running all of those tests, the comprehensive panel today. And then I'll hit start. Alright, so on the comprehensive panel we ran the total protein, the albumin, some glucose, total bilirubin, phosphorus, cholesterol, calcium, creatine, and the BUN, and everything came out normal. So we're going to do a heartworm test using the canine heartworm antigen test kit. So you'll use blood out of an EDTA tube that has the anticoagulant, or you can use a syringe with the heparin in it. So you'll take a drop of the blood, and then use the mix that comes with it, the diluent, do a few drops, and then wait for the results. And it shows that the heartworm test is negative by only presenting one line.